Okay. Hello, everybody. Welcome to today's workshop on mental health and wellbeing. We've got a couple of other people presenting today. So I'm Tim Cockrell. I'm with the Educational Psychology Service here in Somerset. We've got Jamila as well, Health Promotion Manager, who will be presenting in a little bit. And we're not sure if Lucy's joining us today. She's having some technical issues coming in this morning. Jamila, I know you're here. Do you want to say anything else about your role?
So welcome everyone. My name's Jamila Ingram. I work within the public health team and support schools around wellbeing, and it looks like Lucy's able to join us now, so that's great. And I'll be co-presenting with Lucy Six from LIFEbeat. So look forward to sharing our work with you. So thank you, Tim, for the introduction.
Fabulous. Thank you, Jamila. Okay, a few quick house rules for this session. We do need to finish on time today because of that 1 minute silence. So 5 to 12 is our own time. We do plan to leave some time at the end for any comments or questions that you might have about the session. So all three of us will be around at the end for that. Please keep your cameras turned off and your microphones on mute as well. But do put questions in the chat as we go along. And as Sophie said, this workshop is being recorded, so do be mindful of that if you are coming onto video to ask questions, etc. Okay, so what we plan to cover in this session is to give a brief update on the kind of picture around mental health. So thinking about that nationally, but also thinking about that locally in terms of what the trends are that we're seeing with children and young people's mental health, particularly over the last year or so. Then we're going to have a bit of a think about the Somerset Wellbeing Framework, and Jamila and Lucy are going to talk about the LIFEbeat Wellbeing Model. And then towards the end, we're going to think about the support that's available in Somerset and also nationally, and also our future plans around wellbeing and mental health in education. And like I said, some time at the end for any queries or comments or any questions that you may have and want to talk about. So starting off with thinking about the national picture around mental health and wellbeing, it's really useful to think about a specific research that the NHS have carried out around mental health for children and young people. And one of the reasons it's quite useful is because there's a lot of anecdotal information going around about mental health and the impact of the COVID pandemic, particularly on mental health and wellbeing. But this is one of the you see on the screen there. This is one of the biggest surveys that have been completed around children's mental health, and it's quite a big survey that's been going on for a long time. It's one of the ones that they repeat fairly regularly, so they can track the kind of mental health population across time. So the first one, I think it was the first one, it was done in 1999, and then it's repeated in 2004, and then again in 2017. So in 2017, one of the main findings was that about 10.8% of young people were identified as having a mental disorder. So that's not a mild difficulty, that's with the most significant difficulty, meeting that threshold for having a kind of disorder. So that was kind of 1 in 9 children and young people met the criteria for that at that point. With that emotional disorders, that anxiety and depression particularly, noting an increase since the previous one in 2004, and being the most common rate of disorder as well. So one of the things that the NHS did in 2020 was to review and do an update to the 2017 survey, particularly to look at the impact of the pandemic on the mental health of children and young people. And these are some of the main findings from that review survey. So if we go back to that one, it was 1 in 9 having that probable mental disorder, and what they showed is that actually 1 in 6 at that particular time, which was during the first lockdown, I think it was in April 2020, they were looking at more like 1 in 6 had met that threshold for a probable mental disorder. So that is a significant increase in the number of young people experiencing those quite significant mental health difficulties. One of the things that was quite interesting about this survey compared to the 2017 survey was that the kind of categorization of young people falls into 3 categories. There's not just no disorder or probable disorder. There's also a middle category where children and young people have a borderline. So it's a may have a disorder essentially, but there was no change between 2017 and 2020 in the category of very unlikely to have a mental disorder. So what it suggests is that those who were unlikely to have a mental disorder in 2017 were also quite unlikely to have a mental disorder in 2020. But those who were borderline previously in 2017, so they showed some difficulties, but not significant enough to be a disorder, they're the ones who perhaps are finding it much more difficult during the pandemic. And some of that we've seen locally as well. So one of the things that we've noticed locally, so we often collect information across the local area mental health services, so thinking about CAMHS, Young Somerset data, information from schools and settings and from public health. And one of the things that has been noted repeatedly is a kind of general increase in anxiety, but particularly for those who had previous mild or moderate difficulty. So those who were perhaps doing okay previously, but finding bits hard, they're the ones who have struggled the most on average. So anxiety continues to be the biggest theme. So we regularly track mental health data in Somerset in terms of the concerns raised for various agencies and by education settings. And anxiety in various formats remains to be the highest. And perhaps that's not surprising given what we know about the impact of the pandemic, and particularly lockdown and all of this disruption on families and children and young people. We've also seen increases in low mood. Generally, where you see anxiety, you often also see low mood, hopelessness, that sense of kind of the pandemic having a huge impact and not really being able to see a kind of hopeful way out, particularly for young people of certain ages, and also just a kind of general stress that's feeding into that is coming out as a big theme as well, and that's stress for families, which is impacting on stress for young people as well. A couple of more local themes that we picked up in Somerset, which necessarily haven't been picked up on a kind of national scale, which might be because they're not being measured in the same way. But one of the things we've noticed, and you may notice in your settings as well, is what we call an emotional-based school avoidance. So that's got a few other names. It's called school refusal in some places, or anxiety-based school avoidance. But essentially, it's that idea that young people's anxiety is really impacting their school attendance, and they're really struggling to come back. So we noticed that in the September return to schools following the first lockdown, and we're noticing it again in this period as well. There seems to be particular groups which are more prone to emotional-based school avoidance, young people with special educational needs, for example, or those with a history of avoidance or anxiety, and they're just really struggling to come back, some of these young people, which is predictable, and we did know that was likely to happen, so we have put a lot of support in place for that, which I'm going to talk about towards the end. But it's predictable, but it's also that sense that actually we can do a lot to support young people who are struggling with that. We've also seen some small increases in eating disorders. So this data is from CAMHS, particularly some psychosis in adolescents, and also some kind of minor increases in self-injury. But it is worth noting they are small increases. So if you look at the kind of how many young people are presenting with those, the increase is subtle. So we're not talking about masses of increases in those areas. One thing that is coming up is the impact of this lockdown. This current lockdown period it seems to be greater than the first lockdown, and I think we could all hypothesize reasons why that might be. We've got kind of, like we said earlier, that maybe hopelessness around this being there again, but also the winter period as well has contributed to that. So the other thing, just to make really clear, I think, is that actually even though that has increased from 1 in 9 to 1 in 6 in terms of that more significant difficulties, we do need to remember there are huge numbers of children and young people who appear to be managing this all relatively well. I think it's difficult for lots and lots of young people, but I think it's worth noting that the majority of young people will be well supported through the systems that are available to them, and will show resilience in that within the context of that appropriate support being in place for them. But obviously the bigger picture on the kind of of population level is that there are definite increases across the board, and particularly in anxiety. And it'd be interesting to hear your thoughts on this and whether that marries up with your kind of views and what you've seen as well. So perhaps put those in the chat, or we can talk about that towards the end. Okay, but one brief thing from me before I hand over to Jamila is just to mention the Wellbeing for Education return, because I'm going to come back to this towards the end in terms of how we're following up. But just to say thank you to all of those who engaged with the Wellbeing for Education return training, and we had a really positive response considering how busy everybody was in that September, October, November time. But we had a really good turnout for the Wellbeing for Return training, and it was a really collaborative effort with public health, nursing service, and Young Somerset as well. I'm not going to read out those findings, but I will share this PowerPoint with you afterwards if you're interested in looking at it in a bit more detail. But the main message was actually it was really positively received, and what we've done is taken your feedback from that to feed into kind of our plans going forward, which I'll talk about towards the end. And the Wellbeing for Education return training, we've also done a digital version as well, and it's on our e-learning platform, and the link for that is also in this PowerPoint. Okay, over to you, Jamila.
Okay, thank you, Tim. That's a really interesting presentation. I'd just like to follow on from Tim, really, talking about the sort of local need. I came into post in 2017, which felt like a very different world, but actually was asked to look and explore a new tool for health improvement, the sort of Healthy Schools Award. And what became very apparent then in head teachers' circles was actually this feeling of there was a need to look at well-being and what did that look like, but no one was really able to define or articulate what that meant. And so my colleague Fiona and I worked very hard to look at various different evidence-based approaches. And at that time, Reading University and Brighton University were the leaders in school wellbeing and the whole school approach. And we worked collaboratively with partners like Tim and Lucy externally with LIFEbeat to come up with a tool that celebrated wellbeing in schools, because actually what was really important for our community in Somerset is that we celebrated the positivity, because that attracted positivity, and children and young people thrive on the positive. And so how could we create a tool? And also in Somerset, certainly having worked in various different local authorities across the Southwest in my career, Somerset is rich and full of gems of really great practice, but that perhaps wasn't celebrated and communicated in a whole school approach. And so back then, we were really committed to developing a real cultural shift into a positive community of wellbeing. And so out of that was born the Somerset Wellbeing Framework. And I think if we had crystal balls at the time, we would have been called fortune tellers, because had we not known what was about to come in the guise of COVID, we have a tool that has stood the test of time and will hopefully stand the test of time in the next 3 years, in the next 10 years or so, because it looks at really what the heart of wellbeing and what it means to be thriving and resilient in these current times. And so this slide really speaks to the fact of the whole school approach, where if we want that really meaningful, authentic shift, we need to look at these different principles. And so, and one of the things that we're going to focus in on this presentation today is around curriculum, teaching and learning, and how we really engage young people and staff in making that cultural shift. So Tim, if you'd like to go on to the next slide. So for those of you that are new to the framework is an online tool. It's on our website, and you'll get the link to that at the end of the presentation. It's free for schools to join, and we're really pleased and delighted to say, through the work of collaboration with Tim and other colleagues, we have in excess of over almost half of our schools now engaged in the framework. And it focuses on the 3 pillars of well-being, so belonging, relationship and lifestyle. So that belonging is our sense of safety, our sense of purpose, thinking about inclusion, relationships, so around our relationships with ourselves, others and the wider world, and lifestyle, so thinking about how perhaps we take care of ourselves in terms of our physical health, diet, sleep, and our eating patterns. And so those were felt the 3 really strong pillars that can make the biggest difference in that whole school approach and that cultural shift. And I think one of the things I'd just like to bring into the discussion today is that we focus very much on the use of language, and we sort of moved from well-being very quickly and mental health. You know, they're really taking the headlines, but actually one of the things that we have innate in us is that shared longing and need for love. And actually it's probably one of the biggest taboos, but actually underpins really the foundation of what we're all probably striving for ultimately. And so often well-being gets used, but I think deep down there's a much sort of stronger need and sense for that sense of shared understanding around creating a culture of love. And so I just want to introduce Lucy from LIFEbeat, because we've been collaborating with LIFEbeat now for 3 years around our RSHE curriculum, and also on a number of other programs where LIFEbeat have delivered on wellbeing camps for young people. But one of the most important things that we've been delivering in the last 18 months is really looking at that personal development approach, about how we can create those opportunities for self-care, both in staff and pupils. And so I want to hand over to Lucy now to introduce our tool that we've been working in across the county. So Lucy, if you're able to join in.
Thanks, Jamila, and hello to everyone. Yeah, it's a real honour to be presenting today, and thanks, Tim, for your presentation to kind of tee this up. So to create the context really for the need. So LIFEbeat, we're a youth organisation really. We've been running personal development programmes for young people for 15 years, and we're all about experiential learning, which places creativity and group process right at the heart of our model. And so it's been really good to actually take that now into looking at how you apply that to teaching and learning in PSHE, and more recently relationships and sex education, but also as part of a whole school approach to well-being and creating community. So we're all about community, because we see that young people thrive when they find their place in a loving and engaged community. So just looking at this model, this is our little model. It's very simple, but it's kind of fresh really. And I think in this climate, particularly now, you know, during COVID, although we've been working with this for quite some time, it's really important to have things that are fresh and hopeful in the kind of narrative around young people, because they tend to pick up the language of adults and then use it as a kind of narrative through which to understand their own experience. So alongside the kind of safeguarding mechanisms that kind of give young people access to what they need when their symptoms arise, we're really about kind of coming up with a model for teaching and learning and kind of planning curriculum, delivering curriculum that is less focused on the deficit model and more on a kind of skills for life. So this is our little model. And so we go around the pillars, and I'm going to take you through and then it really fits with the framework. So our first one is community and belonging, and what that means, to really feel seen, valued and heard for every pupil and every member of staff, every stakeholder, to feel that they count, they matter equally, with equal dignity, and to find ways to create that kind of school culture, but also in every class. So the next one we have is the physical and the body, and again, so in our sort of approach, we look at the sort of harm reduction, if you like, or the safeguarding, risk management side of these aspects of well-being. So you might look at drugs, alcohol, tobacco, vaping, sugar, no sleep, all those things as being obviously creating harm and less resilience in all of us. But then we very much focus on and encourage the developing of curriculum which looks at how you create a positive relationship with the body. Because even, and I'll go on to talk about this in a minute. So looking at the sort of balance of, if you like, the negative risks which we all have, or choices that we can make around how we take care of ourselves, versus kind of how we water our own plants and what kind of soil do we need to thrive, hence the flower model. So next we go to the mental and emotional, and in our kind of teaching and our programming, we split the cognitive, which is thinking, and the emotional, which is feeling. And so we focus on positive self-talk, principles of gratitude, and then also emotional literacy and fluency, so in order to self-regulate. And then just going around quickly before I go into the first, relationships, as Jamila said, relationship with self is key, and then relationships with others. And obviously at secondary level, that looks at how that moves into intimacy and sex on the basis of relationship. Nature and the environment, you know, increasingly certain at the heart of any education is our link to our natural world. It's probably our biggest threat to humanity that there is, but also how that symbiotic relationship can make us feel well and happy. And then finally, creativity and purpose, that sense of agency, that sense of being able to change and contribute to something positive. So just let's go to the first one as I just take a slightly deeper look at each petal. Thanks. So here's community and belonging. Now, as Jamila said, that's all about inclusion, what that looks like. So does your school culture nurture safety for all? So that's not just your physical safety, you know, all the COVID restrictions and constraints around being physically safe. It's also psychological safety. Are the boundaries clear? Expectations clear? What's the kind of culture of your school around that level of expectation, especially with lots of new beginnings? The emotional safety, so that if a young person takes a risk to share their vulnerability, it's safe in your school culture, whether it's with adults or with their peers. And yeah, that's so all forms, and sexual safety, obviously, in terms of is your curriculum in place around consent, boundaries, respectful touch, objectification, all those kinds of things, which obviously we know get enhanced with social media. Do you prioritize people voice, participation, that sense of agency, not just through a school council, but in your teaching and learning? So it's very much part of learning, isn't it? And so that will create that sense of belonging and value. We're focusing a lot in our trainings around, does a school have a relationships charter that sits with your school values about how you want to be together, the principles of that? Because, for instance, a word like respect means many different things to many different people, depending on your life experience. If you asked a whole range of adults, they would have a lot of different definitions, let alone children and young people. Right, the diversity and inclusion. Do you celebrate difference? Do you make that explicit in your whole school culture? So I know, sort of, for instance, race in Somerset, often people, especially smaller rural schools where it might be predominantly white cohort, think that race is not so relevant. It's entirely relevant in terms of an education for life. And if you are in a minority as a child or young person in your school and you never see yourself represented, you will feel a very limited condition and conditional belonging in your school. So how do you work with that in terms of language and imagery and stories and role models in staffing and governance? So those sort of things are super important for that sense of belonging. And then this idea of emotional literacy and fluency, because we generally feel more connected when we can share authentically, be authentically ourselves. So is there room, space in your curriculum, time, dedicated time where children and young people can develop that emotional literacy and fluency of talking about how they feel? thanks. So those are some of the criteria we see as creating a sense of belonging. And we ourselves work incredibly hard at that on our programs to try and create that ourselves. And so we understand how hard it is because we do it ourselves. So, you know, support you with every small step and huge step you take. Next slide, please. I'm going to whiz through these ones. So the body, obviously, ideally, these themes will be threaded right through the culture of a school. And usually we might look at, is there any time for anyone to rest in the day or reflect? Often not. I mean, I know staff-wise, really it's been the most demanding time in schools for all of you this period. I mean, I can't imagine how demanding it's been. So again, fully support you. But just to remember the principle that if you build a moment in time for 3 deep breaths for your classes, you get to do that yourselves. So again, as Jamila said, your diet and healthy food choices. And then is movement, is the whole body welcome in the classroom? Now, when we're doing our sort of teaching, and it would probably be good to do it now, we often just spend literally a minute doing a stretch or a movement or massaging the palms of the hands, because it, especially if you've got young people with different needs, ADHD or even dyslexia or dyscalculia, inviting the whole body will help them to self-regulate and settle. And then you can see that, I won't go through it all, you can get the PowerPoint afterwards, but again, looking at the harm and risk management in your curriculum versus how do you celebrate and appreciate the body through our senses. There's never been a better time than COVID to illuminate the value of our body and our breath and our senses as a vehicle through which we experience the beauty of life and the world. And obviously, as you're exploring these things in your curriculum, it's really important to consider those that might have some limitation in their senses. So you're always including those with different needs in your teaching, and to be mindful about that. Next slide, please. Mental and emotional, I've talked about that, but splitting it so that you create a culture of positive thinking. I always say we're not responsible for our first thought, but we are our second and our third. So children, young people and ourselves, we can be taught to intervene on our thoughts. And that's the basis of the CBT model, which you'll be seeing through many different interventions coming through, changing that thinking. Do you have a culture of affirmation and appreciation? Do you have a culture of gratitude? Do you have, we do, for instance, daily gratitude circles where we speak from the heart and say what we're grateful for. And it's changing, creating that felt sense. We also do a lot of work around an embodied experience of feelings, even facial expression. If we have a sort of sad and gloomy facial expression, we can play with how that changes our affect, our feeling. So, and then this idea of emotional fluency. Children, young people need a vocabulary. I think sometimes we think that by secondary level everyone's got it sussed. Well, they don't, and we don't, because we can forget. So even basic fluency around name and feeling words and different kinds of feelings, exploring the value of them. You know, grief, sadness tells us something matters to us, which is precious in life. And so there are no good and bad feelings, and using the arts and creative expression to be able to express the stories attached to those feelings is really important. Next slide, please. So relationships, I think where we're at with our approach is our relationship with ourselves is really crucial. It's very difficult to have really healthy, boundaried, mutual, loving, fair share of exchange relationships if we're in a deficit ourselves. So we really prioritize this whole model around self-care in order to reach out and come into a relationship with others. And a big part of that in the curriculum is boundaries. So that moves right through to consent, but just boundaries, listening, the focus on listening, communicating from the I place, understanding the difference, separating out what's yours and mine. Trust and forgiveness, we all make mistakes. That's definitely a foundation of full relationship. How do we learn to communicate through that, trust and forgive? Change, relationships change. How do we navigate that? How do we appreciate ourselves and each other? Focus on the positives in each other rather than, again, the lack. Self-love, as Jamila said, we don't duck that as a premise for relationships, and it is love. It's not just regard. There is something about care for the self that then gives us the empathy and caring and capacity to love others. So, and in your school, is there time dedicated through your RSHE or maybe tutor form time to share some experiences and stories, particularly at the moment? Because although it is business as usual, and obviously young people and children need structure, and they are resilient, as Tim said, there needs to be a held and structured, safe place where everyone can at least touch on this extraordinary time on a regular basis. Otherwise, symptoms will escalate because it makes us feel crazy and disorientated if we can't share and ground the challenge of this time. Next slide, please. This is just a quick run through nature and the environment. Again, you know, really the topic, this is a co-curricular opportunity through all the sciences, geography, where nature and the environment enliven this theme, but our symbiotic relationship with nature. Unless we care about ourselves, you know, I have a lot of associates that are climate activists, and they're always talking about saving the planet, and I say we're very self-motivated as human beings, and really we need to develop self-love and understand that the relationship we have with our natural world is a symbiotic one. In caring for nature, we care for ourselves and vice versa. The breath we take in, which is in limited supply because of COVID right now, we're learning about the breath and mindfulness, is given to us by our natural living world through that process of in and out breath. So, and also, can you in your culture be recognizing the need for sometimes being outside in exploratory ways? And if not, can you use nature in your teaching and learning, in your literacy work around metaphors and poetry? I'm thinking of Gerald Manley Hopkins, you know, to look at natural cycles, the cycles of as we go through the seasons and what that teaches us about life. So just some ideas there. Next slide, please. So just finally, the creativity and purpose. We believe creativity in the classroom is really, and using arts practice, but it's more creative process facilitates learning, and that dialogue and that pupil voice around exploratory learning and investigation of topics that is based on inquiry and reflective practice. So, but also if you can bring the arts, you've probably got lots of brilliant, some of you maybe, we all have gifts and talents. Can we bring those into our teaching and learning to talk about the value of creativity and the imagination, and that we are all capable of an original idea and making something happen, and we can do that together. And that sense of purpose, do you have in your school a culture where every child can access their own value, sense of purpose within the school as making a contribution to the overall health of your community? Because our self-esteem grows enormously when we feel like we can make a contribution. And is that a culture of affirmation and a sort of democratic sharing of that sense of purpose? So that's just a quick, we're going to be doing trainings on each of these modules as part of our SHE relationship, sex and health education, but also as part of a whole school approach to wellbeing. And over to you, Jamila.
Thank you, Lucy. So yeah, so those are the links on the slides there to all of our trainings. They're all free. At the moment, we've been doing them online, and as we move hopefully into next year, we'll be able to get back to some more face-to-face trainings. And I think, you know, one of the things I just want to add to the presentation is around that this is where we're at in the world right now. It has to be a lived experience for us all around relationship. And so when we're looking at that whole school approach, how do we create those opportunities so that it's there for everyone? And certainly within our team, we've been looking at 3 priority areas this year and moving forward into the next academic year, which has been the focus on staff wellbeing. We have the Stress Buster sessions, which we use the tool as a basis for our training, and we've had some really positive feedback with that with school staff. In our curriculum development, and we'll have a series of trainings on offer for you around that, and then also around pupil and parent engagement. And we'll be doing work with LIFEbeat around really making sure that the young people and our parent community are at the heart of it. So what are their needs, and co-creating with them resources and ideas about how we can enrich that within our curriculum and learning in schools. So that's just a flavour of what's to come. We also will hopefully have a LIFEbeat camp for 14 to 19-year-olds in the summer, so they can experience that over an 8-day period. And you know, that's a life-changing experience, and we're very fortunate to be working with LIFEbeat on that. So in the interest of time, I'm conscious Tim's got some slides, so thank you very much for listening. And if you've got any questions at the end, then we'd be happy to take those. I'm just going to hand back to Tim. So thank you, Tim and Lucy.
Great, thanks Jamila, and thank you Lucy for going through the LIFEbeat model. It's really interesting. Yeah, I think if we aim to finish in about 5 minutes or so, and then we can have that time for those comments and questions. So just to finish off, I was going to summarise some of the things that that are currently in place and give you a couple of updates, and just make sure that you are aware of these. You might already be aware, but if not, I will send around this PowerPoint as well afterwards, because there's quite a lot of links on here. So I did mention earlier the Wellbeing for Education return training, so that was the DFE funded. It's really good training. There's 2 different sessions, about an hour and a half each, and it's tailored in Somerset. So it's developed nationally by the Anna Freud Centre for some really excellent content, but it's been tailored around Somerset to incorporate the whole school approach that Jamila talked through, and also to reflect our kind of local area and services. So it's a kind of longer version of a training, but really worthwhile for any member of staff, that one. One of the things we also did with the Wellbeing for Education return in the autumn was to develop a really clear local resources directory. So that's that second bit there around that link. So what that has is a range of Somerset resources as a directory of external agencies, as well as web-based specialist services, helplines all around the area of wellbeing. That's not just the direct wellbeing of children and young people, but also of staff as well, and also support for parents and support for families. I think there's an awful lot out there and an awful lot going on, but one of the things that we heard quite early on was that there's so much going on that school staff actually can't keep up with it almost, and it wasn't all in one place. So that links to quite a lot of other areas and is quite a good summary of lots of different areas of support in that one document. A couple of things that are more recent. So I don't know if anyone's heard of the Big Tent yet, but it's a relatively new and developing initiative around, again, it's a bit like a directory of services around mental health and wellbeing for Somerset. So the links there, do go on and explore, but the idea is that you can filter by kind of area of need, as it were. So you can push on anxiety and have a look at the support around anxiety in Somerset, and you can also filter by locality area, so filter by where you are, and the idea is that that picks up on a range of different offers and locality services from the voluntary sector, those in the community, as well as kind of the more formal services that you're probably already aware of. So well worth looking at, and keep looking at that, because it's in development and there's more being added all the time. We've also got a new e-learning platform via the SSE website. So this is, again, it's developed around the Wellbeing for Education return training. So we've got that longer one that I mentioned at the top there on there. But what we also heard from staff was that was quite long for class teachers particularly, and what they wanted was kind of more videos or e-learning based CPD, but shorter and more accessible. So what we have is a developing number of those. I think there's about 7 or 8 on there at the moment, if you click on that link on this. So you've got various things from anxiety, sleep, so lots of different topics around emotional health and well-being, and they're all around 20 minutes to half an hour roughly, and can be watched at any point for free without logging in as well. So there's lots of good stuff on that, and again it's growing, and there's going to be more added in the next week or two. EBSA I mentioned earlier, that is emotional based school avoidance. So that's the idea. Actually it was fairly predictable to an extent that more young people would struggle to return to school after such an extended period of time away from school. So what we've got on that website is it's a variety of different resources and information. So we've got a comprehensive guide for schools and settings, that's about EBSA, under what circumstances that becomes more likely, how to prevent that, drawing on the whole school approach to well-being in terms of that preventative level. But there's also lots of resources in there for supporting young people who have already experiencing EBSA at the moment. So principles for how to talk to them, how to draw up plans that might help them reintegrate. So lots and lots of stuff in there, lots of appendices, lots of very practical resources for schools about best practice for that area. There's also lots of information for parents on that website. So we've got a training video for an information training video for parents, which is on that link, and also some downloads for parents and leaflets as well. We've also got a section of that site for children and young people of various ages. So we've got, for very young ones, we have a very visual, interactive based, I don't know what they call it. It's a Google Room, I think, but it's basically where you for younger children, where you can click on different pictures, and it talks you through some worries about attending school and some ideas. And for older young people, we've got more of a comprehensive information for thinking about their own anxiety, how it's affecting their attendance at school, feelings about school, and lots of kind of thoughts and strategies about how they can support themselves, which all links in together with the school guidance and the parent guidance. So we've had some really positive feedback about this. It's only launched, I think it was last week, so it is new. If you haven't seen it, I do suggest you check it out, even if you're not, if you haven't got young people who are struggling with this. It's a useful document for that kind of whole school approach, and preventing it from that angle as well. Just a reminder about our 2 helplines. So we've got a parent helpline. So that's come through to Educational Psychology Service. We reply to that within 2 days, and that can be for any parent who's struggling with their child in terms of their well-being. So do signpost any parents to that if you need to over the next week or so. We've also got at the moment a school helpline open, so that's every afternoon 3 to half 4, and that's for school staff who want to come through to an educational psychologist to talk about well-being. So it could be their own well-being, or a well-being of staff. It could be well-being of a child, and it's just a discussion really about what we can do to support or signpost you in relation to that concern you might have. Okay, lastly for me is just the the kind of development really. So one of the things we're looking at going forward is working with the mental health support team areas to expand some of that work around supervision for mental health leads. So the mental health support team in Somerset, like in most places, they're in about 15 to 20% of schools. So the majority of schools don't have a mental health support team around them. But what we want to do next term, and what we are going to do, is provide mental health lead support to all schools and settings in Somerset, irrespective if they're in a mental health support team or not. So what we're doing, I'll just say very, very quickly really, is at the moment we are gathering information about each school and who the mental health lead is for the school. We've had nearly 200 responses on that survey at the bottom, which is amazing. So really grateful to those of you who have responded to that. What it means is that we can get in touch with you and we can offer you training and start setting up some supervision support in groups for mental health leads. So it's a really useful offer. And if you haven't done that survey, I'd be really grateful if you could click on that link there at the bottom. Literally, you've got 3 questions on. It won't take long. But the more names we have in terms of that mental health lead, the more we can offer and the more we can do for you. So it's just notifying us really of who that would be in your setting. But if there's any questions on that, do put them in the chat and we can have a talk about that. Okay, so that is it from us. We've got about 5 minutes. Let me go to the chat and see if there's anything in the chat. Nothing in the chat that I can see. Has anybody got any questions or comments for Lucy or Jamila or myself?
What I'll do, Tim, is I'll just stop the recording. That way anyone can ask a question. Is that okay?
Okay, thanks, Sophie.
Fantastic. Thanks, everyone.